want to watch it again, that's fine. And I'm gonna send the slide deck out. It's 4 slides. This is not killing by PowerPoint at all. But the purpose of this was really just to tell you we're in the triangle of things. We're obviously not, we're not a high touch. We're what we call a medium touch, or what the CDC defines as a medium touch, because we touch some of your equipment. We touch some of the end user equipment, particularly on service calls and things when we actually have to reach out and touch things. And as we were putting this together to keep both our guys and your people safe, I figured it was a good enough opportunity, since all of you guys are going to be dealing with the same things that we're going to be doing over the next couple of weeks, to put this together and steal away, strip off the logo, put it on whatever template that you want, and merge it in with whatever you've started together. Some of you have shared that with me already, and I figured it was a good blending, and hopefully we can share enough that we're not rewriting each other's paragraphs on that. And there's plenty of time for Q&A after this, and I'd be happy to take this in whatever direction that you guys want. In addition to sending out the slides and sending out this recording available if you want to get it, I want to get some time, even if it's just a brief email discussion, or just jump on a phone call with any of you who are planning your opening days. If you're a baseball fan, whatever that is going to look like for your firm. Obviously, I think we did a pretty good job of moving several thousand people from working to home, working to home. I think we did pretty good. I've heard from a lot of you that we did a fairly good job. Obviously, getting all of those people back again is going to require some coordination on that. So I'd love to work with you if you have some timeline or some thoughts, to sit down with you each individually and just kind of help try and coordinate that, and keep it as safe as possible using some of these protocols. So jumping in, kind of go through this, and hopefully everybody can see the slide deck here. And what we're doing is we have some overall methods that we're following. We've done some best practices with, we're in a group of other IT firms throughout the US, actually worldwide, and following some guidelines from them, as well as some of the stuff that we've gotten from the CDC. We're in a holding pattern right now. Obviously, we're waiting to hear from the governor's office as far as what that timeline looks like in Philadelphia and the surrounding counties, and what that looks like. We're gonna kind of play it by ear as far as what comes out as far as that's concerned, and then obviously working with your guys' offices. We have some daily tasks that we're gonna follow, and then obviously when we have to get in the car and drive out and do things, we're gonna do that in a safe manner, and then answer any questions that you guys have. So overall, I did mention to you guys a few weeks back, we did have the office electrostatically cleaned. If you want the vendor that we used for that, it's probably a little pricier than what I thought it was going to be, but it is what it is, and the pickings are slim. Beggars can't be choosers. So, and
what does that involve?
I'm sorry.
What does that involve? The electrostasis.
It's a spray. It's like a droplet spray that adheres to walls and any surfaces, and it clears any corona-based. They did stress that they haven't tested it on this strain, but it does work with other strains of corona, and you basically don't, it smells like a hospital now, if that's any comfort to anybody. So if you visit our office, it smells of ozone-y, hospital-y type smell. And they move everything out of the way, and they clear off desks and wipe down anything that they're not able to actually physically spray. It took about 6 hours for our office, which is about between 2,000 and 3,000 square feet. I don't know what the math is on that one, but there was 3 guys there doing it. But I can take that offline with Judy and point in the vendor that we used. I know there's other ones out there, but this was somebody that I knew personally and said, all right, just come in and do it before this time frame happened, and things are going to get thin pretty quick. Emptied the fridge, cleared everything out. Unfortunately, we're not going to be in a world of common condiments anymore. It's basically there just a box to keep things cold, and everybody's going to have to get real comfortable with that. Single serving everything, sodas, so forth and so on. Keep it in your cooler and bring it out when you want to eat, and box it back up and take it home with you. All the common cutlery and plates and all the fun stuff in the kitchen area, if it's all going to get boxed up, and we'll have some, common use items and paper plates and stuff like that. And if anybody wants any coffee items or anything like that, you can let us know what you want and keep it on their own desk, and try and just minimize touch points is really the biggest thing out of all of this. Our common areas are going to get roped off. So we're going to just use painter's tape. So if you've ever been to our office, we have like a foosball table and a common front desk and so forth and so on. If it's not in use, it's going to get unplugged and it's going to get taped off. Basically, we're just going to have a lot less free roaming area to go with. If you're feeling trapped, go outside for a walk. Hand sanitizer dispensers in all the bathrooms if you don't have that already. Antibacterial soap and alcohol wipes. So there are going to be some things that need to stay on: the fridge, the microwave, the copier, the scanner, things of that nature. We're going to have alcohol. It's got to be 60% based or higher per the CDC. And we're going to have wipes at all of those stations as well, and in the conference room. We have the Christo cars, so we have common cars that are fleet cars that are available for the techs to use. We're going to have them wiped down before and after every use, and especially if they're using the gas station. And daily tasks. So we're going to ask everyone before they even come into the office, do a health check themselves, take your temperature. I know there's question marks on that, but let's do it anyway. Let's avoid on the side of caution there. And then we will have temperature non-oral digital thermometers at the front desk. So if they forget, they can take their temperature and turn around and go back home again if they're running anything. To avoid HIPAA violations, we're not going to track that. We're going to do on the honor system. Just an FYI, we've gotten confirmation on this. Employers, managerial and above, can ask whether or not they're feeling shortness of breath or having any of this. I did not get any. I got a blank stare when I asked if peers can ask that question. I'm going to guess the answer is no. So you have to be in some position of authority over the person to ask that question. That's kind of a wishy-washy answer, but I'm just a engineer. I'm not in that world. So feel free to ask your own people on that one.
Chris, I also heard that you cannot have them take their temperature in public. So they can't be standing in an open environment, with other people.
I did not hear that, but I'm not surprised at that because, I guess there's some privacy to that. I don't care if you take it outside and do it outside and then just bring the thermometer back in. There's going to be a little bit of common sense based on that, but I understand the reason why they wouldn't want that to happen. We're going to try and get a little bit smart about people walking in and out the doors. Hey, let's not gather at any particular area, so let's not wait in line. But if there's people waiting, just give it a couple minutes, like at the grocery store. Stand outside and wait until the next person goes. Mask and gloves, we're going to be stocked at the front desk. I'm going to put a big asterisk on gloves, guys. My guys are really good with the computers. we're not healthcare professionals. I am going to do a training session on using masks, using gloves, so forth and so on. We're gonna bring up some videos. I have my sister-in-law as a nurse. I'm gonna have her do some help with that. It's really, really hard if you don't know what you're doing not to cross-contaminate with gloves. So I'm putting an asterisk on that one, but we are going to use hand sanitizer and wash hands as dictated. Employees are going to ask to be wiped down their common areas, their desk, their cube, wipe it down at the end of each day or whenever they're leaving the office. And then we're going to keep the front doors chocked open just to allow airflow so that we're not, as much as possible, we're going to have some fans in the office, and barring any change of weather here in Pennsylvania, which is always a minute-to-minute fun ride to have, we'll see what happens with that. Service calls, which is kind of one of the crux of the matters as far as dealing with all of your users and all of your employees and everything like that. We are limiting it to emergency statuses right now. This is where I give a heartfelt thank you to everybody for really, really taking this to heart and to being very, very strict with your people as far as what an emergency is. I really, really would like to thank you. I've been doing most of the service calls myself and one other guy, just so we limit our team's exposure until we get more information as far as what's going on. But we're going to be relying on common sense for this as we go backwards and get back into the swing of things. Every attempt to resolve things remotely is going to be taken. So I appreciate everybody's patience on this. It is going to slow things down. So we are going to ask people to try one, or where we try to be respectful of the end user's time as much as possible. We may ask them to do 1 or 2 additional things where previously we would have jumped in the car and just gone and gotten it done. We're going to continue to use those couple of extra college tries. We are going to have medical keyboards and mice. So these are all medical grade camera. These are all medical grade keyboards. They're all washable, scrubbable, so forth and so on. What we're going to be doing is we were going to bring these on site, and so as to not touch people's keyboards and mice, both for your end users' comfort and my guys. That way we don't have to do, we have to do a very minimal touch points as far as if we need to plug this in and work on something on somebody's laptop or PC, and then take it with us when we go. Have wipes, so if we are sitting down at somebody's desk, wipe down armrests, any desk areas that we're touching, both when we arrive and when we leave. Here's an ask for everybody. I know my guys are really good about accommodating requests. We're gonna, with this protocol in place, we're gonna try and be as surgical as possible when we come in and work on stuff, at least until we find out what's going on and we have more data. So I know sometimes when we walk in the door, especially you guys being the points of contact for us, sometimes you hand us hey, while you're here, can you take care of these other couple of sticky note things that we've written down? We didn't want to bother you, so forth and so on. I'm going to ask that you not do that. If you can, if there is multiple things that we can knock out at one time, please just email them to us as quickly as you have them, and we'll work with you to prioritize them and get them consolidated so that we're, again, minimizing those touch points. But please don't hold on to those and just grab us when we get there, because the guys are going to be very myopic. I'm in here to do this, and then I'm back out the door again, both, again, for your guys' sake and ours. We'll have gloves, masks, wipes, so forth and so on. We are not going to be removing equipment. So I will also have work with Star. We have a vendor, and some of you guys have used them in the past to remove old equipment. We're not going to be taking that with us. So we're going to have another vendor remove that equipment, or if need be, stick it under the desk and let's wait and figure out down the road what we're going to be able to do with that. But we're not going to be removing any of that equipment. In addition, at least for the time being, we're not going to be repurposing any old equipment. So if Sally gets a new PC, sometimes Sally's old PC would go to an intern or go to Joe down the hall or something along those lines. For the time being, we're not going to be repurposing any equipment. So we'll be replacing. If Sally needs a new PC because her dies, we'll come in, we'll get a new replacement for Sally, and then we'll figure out what to do after the fact. But for that, that's it for right now. And then on the service call, only one person in the cubicle at a time, just maintaining that social distancing. If so, you use the same analogy. If Sally could go, we'll try and schedule it with accommodations to your staff around lunch times or breaks or something along those lines. But if they could find something else to do while we're there and working, that would be great for both for us and for you guys. And then if the guys are uncomfortable for any reason, they may just work from home for the rest of the day and take calls the way that they've been doing right now. Go home and shower and scrub down, so forth and so on. Please don't take that personally. But that's really what I wanted to review with you guys. And then, like I said, my two asks were really just keeping a dialogue open as far as when you guys were going to start talking about if it's ripping the Band-Aid, if it's a phased approach, if there's certain people that need to be prioritized. Please just reply to my email when I send this out, and I'll happy to start that dialogue with you guys. This deck with what we're doing, I'll share that out. If I've blanked on something, if I've missed something, which I go back to my original statement, not a medical personnel, just an engineer, just trying to keep everybody happy and healthy. If I miss something, or if you guys say, oh, one of these things, please share with me. I'd be happy to start a dialogue with that and include that and share it out with everybody else with your permission. So did anybody have any questions or anything that they wanted to add? I couldn't have been that good, really. No, it is Friday afternoon, so that's fine. And at least I'm going to bring up a screensaver where the mountains are pink, the hills are pink. What? Mountains are pink. So yeah.
I was supposed to be leaving at 1:30. I was supposed to be leaving at 1:30 for Greece today. But it's okay. We'll go another time.
The houses are white. Could you do that?
I'm going to do that when I get home.
That's Caprice, right? Isn't that the white? Yeah.
Yeah.
So that's the plan, guys. I'm waiting on bated breath with whatever the governor's office comes out with, and we're again playing it by ear. Granted, the first couple of weeks moving everybody home was pretty hairy, but we've gone back to pretty much normal as far as end user requests and things that they need to get done and so forth and so on. We're trying to move along with whatever. If you have a project going on with us right now, we're trying to move along with that as much as we can without actually physically doing anything. So I'll send this out shortly, and this always happens to me as I'm turning off things. And, oh, I should have asked something along those lines. If you think of something, just reach out to me. I'll include my contact information on that. Just wanted to give a huge thank you again to you guys for working with us. The patience has been unbelievable, but not only from you guys, but also from your staff. Really can't thank you guys enough.
I do have one more thing I would like to just share.
Sure.
We have a sign-in sheet at the front desk that we put up for people to sign in and sign out. I don't care if people actually use their own pen or if they ask the person at the desk to sign it for them. I just want to have a schedule of who was in the building at any given time.
Okay.
So that for contact tracing, so that if I needed to look back, if somebody comes to me and says something has occurred, I'll know who we have to contact.
Gotcha.
So,
we have the sign-in sheet already for compliance reasons, but having pens there would or not, maybe not disposable pens or something along those lines for people to use. Yeah, it's probably a good idea.
Name pens, you can take it with you.
Yep. There you go. Get some marketing in while you're doing it. Great. Thank you very much, Judy. Awesome, guys. Listen, it's 5 o'clock somewhere. Love you all. Thank you very much. And I'll shoot this out shortly. And thanks very much, guys. If you have any questions, let me know.
Thanks, Chris. Stay healthy, everyone.
Thanks.
Bye-bye.
Bye-bye.
Thanks, everyone.
Thank you, Chris.
Bye-bye.
Thank you.